Blood pressure health. Introduction. Your heart pumps blood throughout your body using a network of tubing called arteries and capillaries, which return the blood back to your heart via your veins. Blood pressure is the force of the blood pushing against the walls of your arteries as your heart beats. There are two types of high blood pressure: primary hypertension and secondary hypertension. Primary hypertension accounts for 95% of hypertension and has several contributing factors. Secondary hypertension occurs when there is a malfunction in one of the body's organs or systems. Primary or essential hypertension can be attributed to a variety of factors. Roughly 30% of cases can be attributed to genetic factors. For example, high blood pressure affects more African Americans than Asians or Caucasians. In addition, there can be a hereditary factor. You're twice as likely to suffer from high blood pressure if either of your parents had it. Symptoms of high blood pressure. Physical symptoms of high blood pressure can often confuse an attending physician since these symptoms can vary, and they can also apply to numerous other medical conditions. This is why it's so important to go through a thorough examination whenever there's an illness, and why your physician will always check your blood pressure. High blood pressure problems are often discovered when a patient visits the doctor with completely different symptoms. If high blood pressure is left undiagnosed for any period of time, depending on its severity, it can cause untold problems for the major organs of the body. This can include cardiac problems, liver disease, and kidney disease. It can also include stroke and even vision. Physical symptoms of high blood pressure include headache, ataxia, difficulty with walking, convulsions, blurred vision, tremors, giddiness. It's easy to see how some of these symptoms can be mistaken for other medical issues. In fact, high blood pressure can often be a symptom of another, bigger health problem. This is why it's always important that a patient exhibiting any of the above symptoms undergo a thorough examination. For example, some of the symptoms mentioned above can also relate to diabetes. Unfortunately, they can also mimic the signs of someone who is very drunk. In fact, there have been occasions when someone suffering from the side effects of high blood pressure has gone untreated because it has been assumed they were under the influence of alcohol. If there has been cardiac damage as the result of high blood pressure, a sufferer may complain of lethargy and tiredness after minor exertion. He or she may become breathless and clammy with perspiration. At first glance, it may simply appear that the patient is out of shape. However, closer examination should uncover the underlying problem and the urgency of the situation. Other physical symptoms of high blood pressure may relate to excretory organs such as the kidneys. Patients may complain of pain when passing urine, or there may be an increase in frequency. Dehydration and dullness of the skin due to a loss of electrolytes in the body may also become symptoms. As mentioned above, high blood pressure can also cause vision problems. Tiny, delicate blood vessels supply blood to your eyes. High blood pressure can damage these vessels. Damaged enough, the blood vessels can leak or become blocked, resulting in retinopathy, bleeding in the eye, swelling of the optic nerve, blurred vision, and even complete loss of vision. Finally, other physical symptoms of high blood pressure may also include a person becoming increasingly lethargic and reluctant to move or participate in any activity. Sufferers may also show signs of clinical depression, heart disease, and high blood pressure. From the day we are born to the day we die, our heart never stops its ceaseless pumping of oxygenated blood throughout the body. Amazingly, it contracts between 70–80 times per minute, day and night, for a typical lifespan of 70 years. For many individuals, it beats even longer. The muscular walls do get an occasional respite during the diastolic phase, but it is only a temporary respite because the heart is never given time to recover from its arduous exercising. It requires a constant supply of oxygen. If you're in poor physical condition and decide to run for a bus, for example, your heart and lungs would be unable to meet the sudden demand for extra oxygen-rich blood. As a result, your leg muscles can't receive the oxygen they need, and you'll likely experience pain or leg cramps. However, on the positive side, you can rest the muscles in your legs and give them the opportunity to recover from their exertion. Unfortunately, your heart doesn't have this luxury. If the muscles of your heart were to rest, your entire body would stop functioning and you die in a very short time. Here's how your heart works. The coronary arteries, which transport the blood to the walls of the heart, emerge from the aorta, which exits from the left side of the heart. The heart tissue becomes infused with the blood and pumps the remaining blood out to other areas of the body. Problems arise when plaque seriously limits the cardiac output. One of the more serious consequences of hypertension, or high blood pressure, is cardiac damage. This results when the pressure of the blood going through the heart is abnormally high, and eventually the heart can't cope with the prolonged and systematic pressure. It will eventually begin to fail, often with devastating results. Once the heart is damaged as a result of high blood pressure, other problems can develop. These may include heart disease such as angina, or even a heart attack with all the accompanying symptoms and problems. Can anxiety affect your blood pressure? As we briefly mentioned above, assessing your blood pressure readings can be trickier than it might at first appear. It's the numerous variables that come into play that make it so tricky. In order for your doctor to gain a complete picture of your specific situation, he needs to be aware of the impact these variables may be having on your system. Here's a short list of factors that can affect your blood pressure reading: your emotional state, exercise, respiration, a recent heavy meal, smoking, your alcohol intake, the room temperature, pain, bladder problems, circadian rhythms, your age, your gender, your race. As surprising as it might sound, anxiety can raise your blood pressure by as much as 30 mmHg. Even anxiousness about visiting the doctor or about how well you'll do when he takes your blood pressure can cause an instinctual fight or flight response that raises your blood pressure. The more anxious you are, the greater the impact on your readings. So always keep in mind that you should be relaxed and comfortable when your blood pressure is taken. If you have the opportunity to sit in a quiet room at a comfortable room temperature and maybe thumb through a favorite magazine beforehand, take advantage of this opportunity to settle down and put aside your fears. You want your doctor to have the best information possible before prescribing any medication. And the best way to make sure your blood pressure readings are accurate is to put aside your anxieties. The more comfortable you are with your surroundings and with the person taking your blood pressure, the more accurate your readings. In fact, it's been found that your blood pressure measurements are generally higher when taken by your doctor, and to a lesser degree, even your nurse. This is known as the white coat syndrome, and it's something to be aware of next time you go to see the doctor. You should also be aware of your respiration and pulse rate, since both can affect your blood pressure reading. If you had to climb a set of stairs to get to your doctor's office and your heart is racing, make sure you have at least 15 minutes to relax and settle back into a comfortable resting pulse rate before your blood pressure is checked. Finally, learn as much about your blood pressure as you can ahead of time. This will generally put your fears to rest. And if you have any questions or concerns, ask your doctor. He should be able to give you a thorough explanation of how your blood pressure works and how it might or might not affect any existing medical conditions you may have. Blood pressure ranges. Blood pressure ranges are not necessarily the same for everyone. There are varying factors that need to be taken into account. For instance, age, race, health, and gender all influence a healthy blood pressure reading. However, blood pressure ranges do provide an important perspective in the diagnosis of many diseases. So, in general terms, a healthy person should have a systolic pressure no higher than 120 mm of Hg, and a diastolic pressure approximately 80 mm of Hg. 120/80 is considered to be a textbook classic blood pressure of an average person. An experienced medical practitioner will often interpret a patient's blood pressure range with the understanding that some patients become excited or agitated simply by having their blood pressure taken. Therefore, a slightly elevated range may not necessarily be a concern in all situations. This is why your physician not only takes your blood pressure every time you visit the office, but also encourages you to come in for periodic readings even when you're feeling fine. The more data he can assemble over time, the more he can determine if there is reason for concern or not. A systolic blood pressure ranging from 140 mm to 159 mm, along with a diastolic blood pressure ranging from 90 mm to 99 mm, is known as stage 1 high blood pressure. Similarly, a systolic blood pressure of 160 or higher, along with a diastolic blood pressure of 100 higher, is known as stage 2 high blood pressure. The higher end of a blood pressure range in a healthy person is normally expected to remain below a systolic pressure of 125 mm. Systolic pressure measures the compression capacity of cardiac tissues in a person's body coupled with the free flow of blood in their arterioles and arteries. Similarly, the lower end of a healthy blood pressure range is expected to remain at or below 80 mm. A persistent low diastolic blood pressure range between 85 and 90 may warrant your physician to prescribe an anti-hypertensive drug. This is even more important if the condition is linked to symptoms pertaining to cardiovascular disorders, such as feelings of intense pain in the body, increased sweating, or with symptoms related to the end organ damage in body. How to take your blood pressure. With almost 80 million Americans affected, hypertension has become a major health issue. As we've already mentioned, unlike many other diseases, hypertension, or what is commonly referred to as high blood pressure, arrives in silence, attacking at times when it's least expected. Hypertension does not have any symptoms specific to the disease. Its crop of usual symptoms, such as headaches, dizziness, nausea, muscle cramps, weakness, and nosebleeds, can just as easily be the symptoms of numerous other medical problems. Some sufferers exhibit no symptoms at all. In fact, for most people, symptoms don't show themselves until the situation is already life-threatening. The significance of this is further highlighted by the fact that high blood pressure is essentially a lifestyle disease. Unlike other medical problems brought on by viral or bacterial infection, high blood pressure often grows worse as the result of the lifestyle of the sufferer. Because of the lack of symptoms, experts advise those who are 35 years and older to have their blood pressure checked regularly. Blood pressure is determined through the use of a sphygmomanometer. Here is a step-by-step guide to help you take your own blood pressure. 1. Sit down and relax. Make sure there's a table beside you where you can rest your arms. 2. Bend your elbow and make sure it's parallel to your heart. Some experts recommend the use of the left arm for testing, while some recommend both arms. 3. Gently place the stethoscope in your ears. 4. Wrap the cuff around your arm. To do this, slip the top part of the cuff through the metal bar attached to the cuff. Secure it by using the Velcro. 5. Make sure the cuff is snug without being so tight that it cuts off your circulation. Otherwise, you risk a false high blood pressure. 6. Place the round, black dial of the stethoscope just above the bend of the arm. 7. Look for a little clip at the back of the sphygmomanometer where the pressure gauge is and attach that clip to something sturdy, oftentimes a hardcover book on the table. It's important that you secure the gauge and to keep it anchored and stable. 8. Tighten the valve at the base of the rubber bulb by turning it clockwise to shut it off. 9. Pump the bulb using slow but steady pressure until the needle on the gauge is 20 to 30 points above your usual systolic. 10. Gently begin turning the bulb's valve counterclockwise to release the air. 11. As you do this, keep an eye on the gauge and listen for a thumping sound. When you hear the first thump, the gauge value is the systolic number. The gauge value indicated when the thumping fades to silence is the diastolic number. Combating the silent killer, high blood pressure, is one of the 10 leading causes of death in the world. Based on studies, it will have a 60% increase by year 2025, when it will hit the third world countries worst. These are some of the most common medications used to help control high blood pressure and its negative impact on health. Diuretics, also commonly referred to as water pills, these are solvents that flush the toxins from the kidney's beta blockers, also referred to as beta-adrenergic blocking agents. These medicines block the effects of a person's adrenaline, causing the heart to beat slower and with less force, thereby reducing blood pressure. ACE inhibitors angiotensin is an enzyme which produces a hormone that can cause the muscles around the blood vessels to contract. ACE inhibitors inhibit the production of this hormone, which allows the blood vessels to expand and the heart to pump blood easier. Angiotensin antagonist similar to ACE inhibitors. These prevent the veins from narrowing. They are primarily used for the treatment of hypertension in those situations when the patient is intolerant of ACE inhibitor therapy. Calcium channel blockers, CCBS, prevent calcium from entering the blood vessel walls, thus relaxing and widening the blood vessels and lowering blood pressure. Alpha blockers help to relax the muscles and keep small blood vessels open by blocking the hormone norepinephrine. This improves blood flow and lowers blood pressure. Alpha-beta blockers almost the same as alpha blockers, except that these work to slow the heartbeat, resulting in a reduction of the blood pumped through the heart and a reduction of the blood pressure. Nervous system inhibitors relax blood vessels by controlling nerve impulses. This causes the blood vessels to become wider and the blood pressure to go down. Vasodilators medications that open the blood vessels. They prevent the muscles in the walls of your arteries from tightening and narrowing. The result is a more fluid blood flow, less effort on your heart to pump the blood, and a reduction in your blood pressure. While excellent medications continue to come onto the market, the very best medication is taking care of your body before it requires additional help. A good diet, a properly maintained body weight, and regular exercise can all help normalize your blood pressure. Natural high blood pressure remedies. Most natural high blood pressure remedies come with very negligible or even no side effects. This is one of the reasons they appear so attractive to someone suffering from the condition. So let's take a look at some of the more common natural remedies. Garlic not only helps to lower blood pressure, but it also helps to reduce your cholesterol level. Extensive research has been conducted on garlic, and it's been found to be very useful as a natural alternative to helping control blood pressure. Coriander leaves in a cup of water may help reduce blood pressure. They should be taken on an empty stomach and preferably in the early morning. They are even more effective when coupled with fresh curry leaves. Cumin seeds are considered one of the major natural remedies for high blood pressure. Ginger is also considered an excellent natural remedy. Onions have been found helpful in reducing high blood pressure. Onion juice, along with honey, should be taken daily. All these remedies should also be taken on an empty stomach. This helps in the absorption and assimilation. Finally, consuming plenty of greens and vegetables has also been shown to help reduce blood pressure. Natural remedies are relatively effective, with dramatically reduced side effects as compared to many of the medicines normally administered, such as angiotensin, converting enzyme inhibitors, or diuretics like furosemide for high blood pressure. Many pharmaceutical companies are exploring ways to identify natural remedies for high blood pressure and determine the active principles in those particular remedies to see if they can be duplicated. This would be an excellent step forward in reducing unwelcome side effects inherent in many medications available today. Of course, natural remedies should be used in conjunction with a healthy lifestyle of proper eating, weight maintenance, and regular exercise, and always work closely with your healthcare provider in developing the proper course of action in dealing with your high blood pressure, whether you're using natural remedies or prescription medicines. Before you embark on a natural treatment, you must first check with your doctor to make sure it won't interfere with your current medications or it won't interact negatively with your current medications. In addition, herbs and natural remedies can have their own set of side effects, and if not used properly, can be harmless. So always check with your doctor first. If you're interested in a safe, natural alternative to using medications for controlling your high blood pressure, you might wish to consider the High Blood Pressure Remedy Report. It will teach you exactly how to stop high blood pressure and eliminate your risk of a heart attack or stroke in just a few short days, using a step-by-step natural home remedy with no worry, no wasted money, and no harmful drugs.